All right, so today we're going to be talking about health insurance because it's a kind of crazy world out there. And also, I sent you that podcast on CrowdHealth. I guess the first thing that I wanted to ask was just give some initial thoughts on do you like insurance? I know that's a probably a, yeah. What are your initial thoughts on insurance and whether it's necessary, not necessary, whether you absolutely hate it or don't absolutely hate it, whatever. Just give some initial thoughts.
We're talking about health insurance specifically, or you want my opinion of all insurance?
We can do health insurance.
Okay. Uh, Health insurance in America is absurd. And pretty much everything that guy said in that podcast you sent me, I don't disagree with because you're paying for everybody else's problems and they're middlemen taking their cut. This was Trump's executive order, a couple months ago with the PBMs, cutting out the PBMs to some extent, saying that manufacturers had to be willing to offer prices that they give to PBMs directly to consumers or pharmacies.
Mm.
Now, other types of insurance I don't have as much of a problem with, but that guy on the podcast was articulating that the incentive structure is just not there for the consumer. Rory Sutherland actually articulated this well. He said, in businesses where the consumer is not the customer, and it has been my opinion for a long time that by and large, the insurance company is the customer, although you could make the argument that the PBMs are the customer. And the person with insurance just happens to be the consumer. So going to the hospital, having gone to the hospital with my kids, it's very clear you're not the customer. Because in a business where you're the customer, you get prices, they handhold you through things. There's just, you don't walk in and it's a black box. Whereas in a hospital, that's absolutely how it is. And God forbid you should question everything. The addendum to that would be I don't think a lot of care providers are meaning it to be that way. I think they're well intended people. But it just happens to be that you're not the customer. So you're going to get crappy service.
Yeah.
Those are my thoughts on that. And you're going to overpay. If you're a healthy person, you are going to overpay because you got to pay for the people who are unhealthy and being charged exorbitantly to solve those problems.
So would you say that if you're an unhealthy person, you're probably going to underpay based on what you should have paid in your current health state?
I don't know about underpay, but it may be a better value proposition for you if
Mm.
you've got a metabolic disease or cancer, kidney failure. Finding the cheaper alternatives is so much work and so extremely stressful trying to navigate medical billing that getting insurance and staying within whatever provider network they have may be the better option. There was a gentleman that I recently talked to that I thought that's actually a good perspective that I don't think some people take into account, and I certainly wouldn't have a while back, which was that if you have to go on Medicare, if you're going into medical bankruptcy, for whatever reason, you just don't have enough money to pay for whatever the medical procedure is, and you're offered Medicare. Yes, Medicare. Medicare and Medicaid. I always get them confused. Which one is the old person one? Which one is the I don't yet have the means to get this treatment?
I'm pretty
I
sure
think it's Medicare.
that's, yeah.
Okay. So his comment was unless you are swimming in cash, go with Medicare. I think it's Part B. One of them is pretty high premiums, but you don't pay for hardly anything. And the other one is lower premiums, but you're going to pay out of pocket for several things. And I don't remember how that breaks down as far as whatever it's called, deductible within Medicare. I don't know if it's called something else. And his comment was, if you're dealing with a chronic medical condition or you think you might and you don't have a ton of cash, go with the high premium version. Mathematically, you may end up spending more overall, but the stress of waiting for what could be a massive medical bill for 12 months and then getting it and then negotiating it and navigating that whole web will might kill you sooner. Just the chronic stress of dealing with the system might kill you sooner than whatever the chronic thing is that you already have. And I think I tend to agree with that. I'm coming around to the idea. My short life currently, I've gone with high deductible HSA plans and I save money and use that. I'm warming up to the perspective that if you're going to have insurance, go with a silver or gold plan, pay high premiums, and then you don't have to worry as much when life slaps you in the face. But that assumes that you're getting insurance. I think what you're kind of wanting to talk about is, okay, what are the alternatives to getting insurance or alternative types of insurance?
Yeah,
Is
I
that
mean
correct?
that I think that's a good thing to talk about, especially because insurance premiums are getting so high, and it's not like the it's not like deductibles are
Mm-hmm.
lower just because the premiums are high. It's just no, premiums are just going up. And so I think that CrowdHealth, which we can talk about a little bit, is a great alternative. And I think there's also other alternatives that you can kind of combine together to prevent big health events in the future, which is kind of like an insurance. But yeah, we can get into crowd health if you want to, just talking a little bit about it.
Sure, lead the way.
So on the podcast, the main thing that he talked about was how insurance is like everyone paying and then them having like a bucket of money and paying out money to whoever needs it, but they also don't do a really good job of that. So it's not really working. So then he created Crowd Health, which I can't remember what his name was. It was actually a kind of long name. Um, but he created Crowd Health to be more of like a Christian focused um platform for people to pay into and then also to help each other. So basically, the way that Crowd Health works is I have a health event, I ask the community to help me, or I submit it to the community, and then they ask whatever 100 members for $50 or 100 members for $100 or something. And then those 100 members can say yes or no, and they'll keep asking until they get the whole whatever it is, surgery or whatever paid for. And then you go back and those people, when those people ask or like when they submit a claim, you can see if they have paid for the claim that you had submitted. And so then there's kind of like an accountability there where if they helped you, you're more willing to help them. But if they said no, then just in terms of like human selfishness a little bit, like why would I help you if you didn't decide to help me? So I thought it was a cool spin on insurance. Technically, it's not health insurance, but it's like a similar idea, and it's just a community of people helping each other. Um, and it costs a lot less in terms of a premium, so that's really nice too. But yeah, what did you think about it?
My thought on I'm going to go last comment first, which was the cost. I think he said he was paying like $1,200 a month on premiums. Now, he also is well off, I'm assuming.
Probably. He did sell a company or something.
Yeah, yeah. So he's paying the full price of, and I think he said he was on some Affordable Care Act plan for a bit. So he's going to pay the full price for that. Most people are not going to be in that situation. I've got three people on an Affordable Care Act plan, and we're paying $460 a month. So it's a lot. I mean, it's when I add that plus my wife's insurance, it's our single largest budget line item after saving for retirement. So, well, and mortgage. Mortgage is nuts, but I'm happy to pay that one because I like having a house.
Mhm.
Where was I going with that?
Expenses, just how big it
Expenses. Yeah. So when I priced out Function, I think the $15,000, they have two tiers, right? Was that Function or was that something else?
function was the lab testing.
That was the lab testing. Okay. And that
CrowdHealth,
was it was 100 a month for Function, right? 150.
50.
Yeah. So what I'm paying
Longevity
now,
was 130, function was 50.
okay. Function was 50. Gotcha. Yeah. So what I'm paying now is roughly 150 per person per month. My wife is more like 220, 230 per month, but that's kind of a different thing that we're doing there. That she's on a separate insurance because she's a woman in childbearing age and I like babies. So we have her on a sharing plan that's really good at paying out for babies. Anyway, so I'm paying one third ish. No, that's not true. One half of what he was articulating. Still expensive. Uh, my thing was if you priced out Function or priced out this guy's thing,
CrowdHealth.
CrowdHealth, you also want to factor in, okay, if I get requested every month, which is probably not the case, maybe 6 out of the 12 months to send extra money to people, add 50 or $100 in because it wasn't that an additional to the premium.
Yeah.
Um,
So
so the true cost is going to be a little bit higher than what the ticket price is. But I mean, this is insurance. You're spreading risk out through a bunch of people. What I liked about it and what I think could be highly valuable, and I wondered if you moved one person in your household to their system, if you could have access to the resources, was he stressed their database for looking for non-hospital outpatient procedures that were half, a quarter, one fifth, 1/10 the price of what you would get if you build insurance.
yeah.
I know our local hospital, if I walk in there and tell them, because in Indiana I can say don't bill insurance, and they can't do it. I get a three-quarters discount. So it's like unless I'm walking in there and a bullet went through three organs and I'm bleeding out, I'm just gonna be like, I'm self-pay. Charge me cash. Because the difference between a $40,000 bill and a $10,000 bill is so extreme. And
Yeah.
now, of course, on insurance, eventually I'll hit my maximum out of pocket. But yeah, it's nuts.
Yeah, that is. Did you hear the story that he talked about of the guy who actually did have a bullet go through, like it was
Yeah,
his calf, his thigh, and then his back?
it's a bad day.
That was, and he was in a coma. And the first thing he said when he got out of the coma was, "We're pregnant,"
Yeah.
because his wife was like 2 months or 3 months pregnant or something like
Uh huh.
that. That's just crazy. But it was like a million. Well, no, he said it ended up being like what, 250,000 or something.
Something like that. Mm-hmm.
And yet everyone chipped in and paid for it. The thing that I think I like about CrowdHealth is that, I mean, yes, there's still the uh you're not guaranteed to be paid for necessarily, but I feel like the
Mm-hmm.
probability that they will, if you submit a claim that's like reasonable, the probability that you will be paid for is, I feel like it's much higher than it would be on some health insurance plans because they literally have advanced AI that's trying to deny as many claims as possible so that they can make their premiums and not have to pay out um for regular health insurance providers. Like I actually read an article that talked about that the advanced AI that just tries to find the loopholes in whatever claims people have and then just denies them. And also the guy on the podcast talked about how if they haven't had as much profit for the year or whatever, or they've had like depending on their profit level is whether they'll deny or take more claims, which it kind of I believe that um just based on how selfish some big companies can be. And I don't know, that doesn't really make me trust health insurance anymore. That actually, yeah, that just hurts their reputation a lot. So I don't know. Do you think that there would be any difference in like submitting a claim for a health insurance provider versus submitting a claim to CrowdHealth and whether you might actually get it paid for or not?
I think the worst person to submit a health claim to is insurance. It's a terrible system. Well, first, the hospital's not going to get your bill for Lord knows how
Oh,
long. And then you got to get it paid and hope that it's approved. We, by and large, haven't had any issues with our insurance, but we're also relatively healthy people. Like, the only major expenses that we've had have been having kids. And foreseeably, that's probably a standard run of the mill. I mean, as long as you don't have some major complications, those procedures are pretty well lined out.
yeah.
So I think some big benefits to a third party, someone that's not officially in insurance, are they're probably easier to work with. You're the actual customer.
You have your own representative, is what he said. Like you
Yep.
specifically have one representative who knows you and knows your area and can
Mm-hmm.
help you find those
Yes.
functional doctors.
In theory, if they've done a good job, your incentives are aligned in both that you're wanting to find a good deal and hopefully, although I don't know if they have a mechanism for this feedback, they are also screening for client experience with the provider. So hopefully, if you had a terrible experience and three other people did with this provider, they'll be like, yeah, maybe we're not sending anybody there. I don't know if they capture that kind of data, but you probably will get a much better user experience from that. I would say the only downside to having a third party, like we've talked about previously, is are they solvent? Is there enough money there to pay for money going out? And do you actually think they'll keep doing what they say they will do? I don't even know how you would measure that. I was listening to a Dark Horse podcast, which it's an interesting perspective. I'm not, I don't agree with everything that they say. That's Brett and Heather Weinstein, who are evolutionary biologists. And some of the stuff they speculate, I'm like, whatever. But I think they have some good points. And this one I was listening to, they mentioned you want to be able to trust the people who are advocating for you or who are supposed to be advocating for you. And they were talking about in terms of RFK or his predecessor, and some of the people who are vouching for policy with health. You want to be able to say, well, what the FDA put in place that my doctor's now recommending to me, it may not be the best option, but is a good option. And they have my best health at heart.
Yeah.
But it's not always the case that so there's always this part of you that's like, I need to double check these people because it could be fraudsters or whatever. We've talked about previously. There is a medical sharing organization that I used for a while, and somebody I know couldn't get a massive medical claim approved through them. So I don't recommend them anymore. And it like they almost went to court. I don't even know if they started the whole court process and finally got it paid, but it was like nightmare.
Dang, that's insane. Uh,
Yeah.
wow. One thing that I thought was kind of cool and kind of goes along with your um, the fact that you like the resources that they have in your area was the fact that he said he either could have gotten a $40,000 back surgery or he could just go to the chiropractor each week, which
Yeah.
again, I know there is a little bit of a barrier. Like if you don't have enough money to do that, it's not like you
Right.
do that every week.
Yes.
However,
Yep.
you also don't have enough money to pay a $40,000 surgery, then it's kind of a wash because
Hmm.
either way, you're gonna have to pay something. So, but I did like that he mentioned, and we have talked about another insurance is taking preventative care of your health, even if it's not necessarily paid for by your insurance,
Yeah.
going to the chiropractor or just doing eating correctly and like strength training. And so the reason I kind of like CrowdHealth is one, they provide resources, but two is they give you some like natural solutions that you can do instead of, just going and getting the surgery. Because I feel like
Hmm.
the more podcasts that I've listened to, specifically the podcast, the person who like runs the podcast that he was on, they always talk about natural solutions. And so the more that I've listened, the more I'm like,
Hmm.
I feel like natural's better 90% of the time. And so if you can try to lean that way and not just automatically go for the pill or automatically go for the surgery and instead try and do it
Right.
naturally,
Right.
it's going to be better for your health long term. I don't
I
know.
tend to personally agree with, like, I always seek out a natural or DIY solution before I go to what pharmacology will fix this. I will, I definitely, with the natural solutions though, I am all about, well, you're gonna make a claim and I'm gonna go look it up and we're gonna find out how true that is because there's just so much bloviating, fraudulent stuff that it could be, you might be spot on, or half of the claims that you make might be spot on and half of them you just made up. Maybe not made up, but uh, you know, there's an anecdote, which is fine, but let's see if it's documented anywhere that is true. So I always go back to the hemlock is natural, but I'm not going to eat hemlock unless I have a great reason to do so. Is there a dosage at which it's going to help me treat some health problem or kill a parasite or something? Sure, I'm not saying I will never use it, but I'm not going to go munch on some hemlock and end up dead just because it's natural.
Yeah.
Likewise, I'm not going to turn down a antibiotic because it is synthetic or because it was grown in a lab, or insulin for that matter. So I do have a little bit of a, I personally prefer natural, but I'm going to do my research and I am not going to be opposed to pharmacology if there's no other solution.
Yeah.
I To put this in perspective, like every single, at least this was for a while, every single somewhat opioid derived painkiller came from four plants. This was like 15 years ago. There are amazing natural compounds that we've either understudied or have not been made into drugs yet, or we haven't looked into yet. So I don't know. The barrier between natural and synthetic is sometimes paper thin, and how you decide that, oh, well, this is natural and this isn't. I would argue that honey is almost an unnatural thing because through the course of human history, you had to like put yourself in a burlap sack and cut down a tree in order to get it. And it was guarded by 60,000 venomous animals. So the chances of you getting honey without being maimed severely is quite small.
Yeah. No, that makes sense. Do you think, well, okay, actually I have one question first and then a follow-up question on that. So, would you say that part of the reason that your health insurance is affordable, more affordable, I guess, is because you're not in like the upper range limits of income. And then the question, I guess, is if your income continues to grow, would you consider switching if your premiums went up because like you were in higher income brackets or whatever?
I already have considered switching. I've considered switching to what my wife is on. I've also considered either switching just myself or somebody to function or levels, those kind of ideas, because I think there's lots of value in getting all the labs and then just using the internet to search through them.
Yeah.
But I don't know if I make more income. Yeah, I might be more likely to look for other alternatives. It's somewhat of a numbers game because right now my maximum out of pocket per person is, I think, like $8,000. So nothing's getting paid for until we hit the deductible, which is like 700 and or $7,500. Then the maximum out of pocket per person is $8,000. My maximum out of pocket per family is $14,000. So two of my kids, I don't know, their spleens rupture. I'm out $14,000 before anybody does anything. And then insurance, in theory, will cover everything else.
In theory.
So, in theory. So, when I look at stuff where the deductible is $15,000 and it's only $100 a month or whatever, then that math starts looking much better.
Mm, yeah. So with CrowdHealth, I mean, what would be considered the deductible? Would there be a
The Was it CrowdHealth that had a five that was
but
a
wouldn't
five
that be
hundred dollar?
premium? Or
Well, your
oh
premium
no,
is your monthly cost.
you pay the first $500. Yeah, no, that makes sense.
Hmm.
So that would be your deductible.
I
You
would I
first,
would call their premium their whatever monthly payment
yeah,
plus some estimated how many times are you going to get asked to pay for other people. Just calculate that in, stuff it in savings. The problem with all these healthcare things is that unless you're poor and you are on Medicaid, which is a funny thing to say because like all these medical things will make you poor uh, if you have a medical problem. Unless you're on Medicaid, you need to be saving for a health problem because it's going to happen. And all of these things have some portion of you got to pay for this portion of this health issue. Um, Now, $500 is a pretty low bar, but depending on who you go with, 1,000, 2,000, 4,000, in my case, 8,000, you got to be saving in some fashion.
yeah. I I think that if I were to switch to CrowdHealth, I would try to get as many people to switch to CrowdHealth as possible because the more people, the more likely it is that other people will be paying for other people's stuff and you won't have to pay quite as much. But also, I wouldn't join CrowdHealth selfishly. I would join it like to help the community, and then that way the community is willing to help me. But
I
yeah,
would absolutely join it selfishly.
not quite as selfishly as some people. He said that there's people who like would have a knee surgery coming up, and so they join, get the knee surgery paid for, and then leave right away.
Okay, well, yeah, that's a little ridiculous, but
Yeah.
uh, I mean, there's no reason to be in. Otherwise, I'm just doing charity. I might as well just donate, right? I'm not going to pretend like I'm there magnanimously, and it's kind of like going to work. I'm there because I need food. I'm not here because I'm like, this is, I don't know, like playing tennis on a Saturday or something.
Which, by the way, I've been playing sports a lot this week, and my hand is feeling a lot better. So
Good,
I think
good.
pretty much back, which ironically, I haven't talked about this at all yet, but the fact that I broke my hand and then we got it was one $550 bill and then one like $460 bill. So it ended up it was a little more than that. So it ended up being like $1,025 total that I had to pay for the two X-rays that I got of my hand, which was
Mm-hmm.
it was tough, but I it was funny because without the self-pay discount, it would have probably been closer to $1,500.
Yeah,
And so it was just funny that it happened right now. And that's probably why I thought of insurance and
yeah,
why we
yeah.
wanted to talk about it.
It, the other, I forgot to mention the other thing about these third-party health insurance that I like is that these places, though slow moving and I think dumb, they're not necessarily stupid as well, meaning they are observing consumers,
Mm,
although they're not responding to them very well. But once you lose so much of a pool of people, you start to notice okay, people are opting out of insurance. They are opting to pay cash because they hate us so much. Now, I don't know if this is really going to change existing health insurance, but it might make some of them go bankrupt or move into a different I want them to move into a more consumer responsive service. That is what I want. We're not there yet.
yeah,
But maybe we can get there by voting with our dollars that way.
it would, yeah, that, and it's just going to take a ton of people either switching or banding together to make a change because sadly, one of us not choosing to pay insurance is not going to do a whole lot. But
Mhm.
if you had, which I'll go first, but if you had one suggestion for people, what would it be? And then I'll say mine. So my suggestion would be like look for natural solutions. And again, I know the like you said, the line between natural and synthetic is quite thin, but also if you do your research, it can be much more clear and obvious. Like going to a chiropractor versus getting a surgery. I feel like that one's as long as you do your research and realize that or figure out that like yes, the chiropractor will help me heal similarly to what the surgery is, like there's a clear difference. One's pretty natural, one is like a surgery where they're going inside you. Um, and then just like taking care of your body because that's honestly the ultimate insurance is covering the small multiple small healthcare costs that will creep up. Obviously, if you like tear an ACL or something, that's you can't really prevent
Yeah.
that other than just like not doing anything and sitting in your bed. Like so, it's just gonna happen sometimes, just
Mhm.
depending on the situation. But then again, if you sit in your bed, you're gonna have much different healthcare costs. So I would say just like take care of your body, and that's it's probably the biggest thing you can do to save yourself money in the future.
Right. Yeah. What an ounce of prevention. The other benefit to these, I agree with you. That's where I'm going with this. I agree with you that prevention is the best form of keeping your costs low. And if you're going to go on an alternative to insurance, probably a good idea anyway. And what I liked about this guy's thing is that they wouldn't take you if you smoked or if you were obese,
Hmm.
just because there are so many complications tied to that. And those are both solvable problems.
Hmm.
So they have aligned their incentives with the people who want to do the consuming of their service. Whereas insurance, it's like the incentives are we'll pay for you to go to a primary care physician once a year and they'll listen to you cough and tell you you're fat. Great. So super helpful. Thanks for that. Uh, but yeah, I would say that that's probably key here is you want to save for a health event because it's going to happen and all the other time you want to take care of yourself so that you can keep some massive liability from creeping up.
Yeah. I mean, I think that's the biggest cure of them all is just take care of yourself.
Right, right. Oh, I wanted to mention about the response to consumers versus the customer. Local hospital in town, they used to have midwives and then stopped because, from what I understand, there was some internal infighting between the OBs and the midwives, and the OBs didn't really like, slash the hospitalists or whoever didn't really like the midwife practice. Thinking on birth is a little bit different there. And so they did away with it. And I heard from several people, they were like, yeah, I really hated that. I was really looking forward to using the midwives. Well, now they're bringing them back because it's like they lost their whole customer base. Like you expected to keep the same customer base, but you got rid of the reason people were there. So people just stopped going to the hospital to have births. It's like, no crap, Sherlock. Good job not listening to the consumer. And we'll see if they come back. I don't know that they will. We won't. I have no intention of going back there after our experience with the OBs. So,
Dang. Yeah.
whatever.
It's so if anyone wants to reach out to us, it's jc.unscripted@gmail.com. So just let us know and give us suggestions on topics in the future.
Yes. Yes. Good
Alrighty.
suggestion.